Hello and welcome to our Nursing Through the Decades podcast, where we talk to nurses who trained in different decades from 1970s through to the present day.
My name's Jill Craig and I'm currently a practice education facilitator. I started my working life in an office and realised not only was I very poor at it, but I was bored. I had thought previously about a career in nursing, explored it further and applied, mainly because I wanted to help people. I felt it was a vocation and one that I would be able to do. I started my training at the Hull School of Nursing in 1972. So September 72 to 1975 I did my training, and I had placements at what was then Kingston General, Hull Royal and Princess Royal as well. When I qualified, I worked on the cardiac monitoring unit. I enjoyed it. It was something that was either extremely busy or very, very quiet. And I felt, considering all the placements I'd done, and one of them had been the community, that's where I would like to be. I wanted to develop deeper, longer relationships with patients and their families. So as an adult nurse, being a district nurse seemed to fulfil that criteria for me. And I actually only spent, I think, 6 months on the cardiac monitoring unit before I was appointed as a district nursing sister in Hull. And that was, I don't think I realised what it was going to involve. I must have been quite naive. I worked in West Hull. It was an interesting area to work. We were attached to GP surgeries. So my area would run from areas of deprivation right up to some really nice housing estates, and further out, wherever my GP's patients were, I would go. And yes, I enjoyed that very, very much. I felt very privileged to do that. I enjoyed supporting patients and families for palliative care, for end-of-life care. That, for me, enabled me to use all of my nursing skills. You have to be very compassionate, naturally, and support people to care for long-term conditions in patients' homes, because you weren't there all the time, so you were supporting families to support their loved ones when you weren't there too. So for me, being able to discharge patients was also a big tick in the box as well, that you felt that you'd got them to optimum health with support, and discharging that way was always very positive. When I qualified mid-70s, starting in the community, we used glass syringes for injections, and the needles for the diabetics were sent away to be sharpened. And that sounds pretty horrendous today when you think about it. But of course, there was no evidence-based practice. There was simply experience. If we had to dress a wound and pack a wound with any sort of gauze, the patients used to put it in a metal biscuit tin and bake it in the oven before we arrived. I have a certificate in district nursing because I achieved that qualification in the 70s. And you were assessed, and you were assessed on your ability to make paper rubbish bags out of newspaper. A lot of patients had open fires, so a lot of the dressings were burned. You were also not ever expected to go back to your car for anything, so you had to have everything in your bag. And you also had to have 2 bowls and a jug, 1 bowl to put the hot water in to wash your hands, and then another bowl to empty it in, and you were assessed on all of these things. My patients that were palliative, end-of-life care, they were nursed on sheepskins. So like a sheepskin rug, they were nursed on sheepskins. And the patients' relatives were taught how to turn them and to care for them. And I used to go out every 4 hours, even during the night, to give injections, because we didn't have syringe drivers in those days. Wound care was very, very different today. You soon learn what worked, what didn't, but what you didn't know was why. And that's the bit, as I look to now, we have evidence-based practice. So we have options for patients. We can explain. We can give them choice, as we should as well. So things have moved. I think what I would bring from the 70s, probably the biggest gift would be time. Because even though we were very busy, I wasn't regimented by the ledger or mobile phones. I could give the time required that I believed that my patient and family needed. So I think those are big things. Now I work as a practice educator, so I support the next generation of students to do the best. And I think what I expect from them is kindness and compassion and professionalism, and to remember something that my nurse tutor always used to say: if you treat your patients as you would have yourself treat or your family treat, and also that nurses have to have very broad shoulders, and I think sometimes that they do. Nursing is an honourable profession, and one that reflects beliefs and ethics that you enable. You can care for people by enabling them to be as well as they can physically and mentally. And that's nursing.